Welcome to CTV News Trendline with Michael Stittle and Nick Nanos.
We came up with solutions in 2002 with the Romano Report. 47 recommendations. A lot of them were never taken into practice. And a lot of them, I reread them the other day and I thought, well, why don't we do some of these, like electronic medical records, so that someone can get care in different areas without a lot of paperwork? Why do we have duplication between provinces and a lot of managerial staff as opposed to it going more to healthcare? That report has a lot of really great ideas that, if they had been implemented, might make our healthcare system right now have been much more robust and look much better than it is, and have much happier staff working across the board. But you could pose suggestions, but if there's no political will, and if the electorate is kind of like, help us, what do you do?
And I think, Avis, to your point, part of the problem is mixed accountability, right? So, the feds play a significant role in funding healthcare, and the provinces are delivering, and that mixed accountability has led to mixed results, period, full stop, right? And it just messes things up. Because there needs to be someone accountable, really. And I think right now, just from a governance perspective, there's not one level of government that's fully accountable for healthcare. And for average Canadians, they don't really care, right? They don't really care what the governance is behind the curtain, as long as they get the healthcare, as long as they have access to public healthcare, and they get it in a I'll call it a reasonably timely fashion. Because, to your point, they know that it's a public healthcare system. They know you got to wait a little bit, that it's not going to be on demand. But the thing is that lack of accountability, and I think someone needs to take leadership on this. And I'm not sure whether provinces or the federal government are hot to take leadership on this, maybe because it's a tough issue and not necessarily a political winner. This would be a great issue for someone that's going to retire. I just like to say that, kind of like a legacy issue, to say, okay, I'm not going to be the leader of whatever, but for the next 2 years, I'm going to do this, and I'm not, and to just push it through. Push through some leadership and accountability, because I think the problem is that for anyone that's seeking re-election, it's kind of like Vietnam, right? You get mired, in jungle warfare, and you're just in a swamp, and that there's no political win. And if there is a political win, you will never be around as a politician to do the victory lap. You'll be around as an individual, retired politician, to take credit, but there'll be no short-term gain.
Question for you, Nick. What level of government do you think should be accountable?
Well, I can just speak to the numbers. Canadians expect national standards, and they expect provinces to be able to deliver, or regardless of where you live, to get a reasonably comparable level of healthcare service. So, I would say that if you asked average Canadians, what they'd want to see is the federal government lead on standards and implementation, but that there'd be kind of local operationalization of whatever the national plan was, right? So that if you're why don't we use an example? If you're in a rural hospital, you'd have to meet the national standard, but you still have some flexibility to deal with your special patients, and the fact that you're dealing in a rural hospital as opposed to a hospital in a high density urban area. But I think for average Canadians, if you'd ask them who should lead, they'd say public healthcare is a national priority. We need national standards. The federal government has to pony up and set those standards, but we should be allowing local healthcare facilities some flexibility to meet the needs of their unique communities. I think that's probably the way they would go, but that it would mean a heavier hand for the federal government on this.